Now, let's go over a few things that will accelerate your healing. First, let's go over a few things that you should not do. First is no sweets. So I want you to cut out sugar or sweets. Why? It's because sugar gets your body in a state of inflammation. Meaning, let's say if you're drinking coffee, I want you to cut out the sugar, drink it black, or if you want some sweetness, put some honey in it. Definitely cut out the soda, cut out pastries, even those power drinks. They're high in sugar. So let's cut those out or let's minimize them. Second is I want you to avoid dead animal products. This is not to say that I want you to be vegetarian. It is not that. But I want you to follow the 80-20 rule. Let's say if you're eating a plate of food, meaning 20% of your food should be chicken, pork, or beef. And then 80% can be your veggies or some carbs. Fish is okay because it has antioxidants. So fish you can. It's the chicken, pork, or beef that really is the one that you want to cut down on. Okay? And when I say dead animal products, that includes milk, that includes yogurt. Cheese is processed, so it's okay. But the milk, the yogurt, egg, let's cut down on those. Okay? And then no kneeling. Because later on, you'll be able to kneel. Because that's a common question I get asked, especially for religious purposes. Later on, when your knee is fully recovered, you'll be able to do that. Although I still don't recommend it because it shortens the lifespan of the prostheses. But initially, very important is no kneeling. You don't want any excess pressure there to cause more inflammation. And then also, no deep squatting. You'll be able to squat in the future. So at the beginning, don't squat deeply like going down, sitting on the floor. Let's avoid that because it causes more irritation and inflammation on your knee. Okay? And this is very important. A lot of people do this. Do not put pillow or towel roll or anything under your knee when you're resting. Meaning when your leg is up on the bed, don't put anything under your knee because it will make your knee bend. It is a very comfortable position, especially post-surgery, but it is bad because it will not allow your knee to go straight, and this will cause a lot of problems. All right? So make sure no pillow or towel roll under your knee. Do not let your leg roll out when you're lying down. Sometimes the foot rolls out and then the knee starts bending that way. Avoid that also, and avoid prolonged sitting because that will make your knee stiffen up in a bent position. So I want you to follow those. Make sure you avoid those things that I mentioned. Okay? Now, let's go over a few things that I want you to do. First is I want you to take breaks every 10 minutes or 15 minutes. Kind of in line with what I said, prolonged sitting, avoid that. So if you're sitting down, let's say watching a movie, watching TV, every 15 minutes or so, 10, 15 minutes, I want you to extend and bend your leg. I want you to move your leg, or I want you to get up and walk around. Okay? So I want you to take breaks every 15 minutes there, break that prolonged position you're in. Second, I want you to start taking turmeric if you're not taking them. If you are, how much of turmeric are you actually taking? Some people just sprinkle that in their food. That's not enough. You have to take more of that. The easiest way, because I know it has a funky taste. A lot of my patients don't like taking it. But you can put them in a capsule, or they sell capsules that has turmeric in it. I want you to take that because turmeric is a very potent natural anti-inflammatory. So that way you won't have to rely on the anti-inflammatories or painkillers that the doctor is giving you. All right? So make sure you take that. And I want you to ice 2 to 3 times a day, 10 to 15 minutes each time. Because ice will help your inflammation. That will help with the swelling on your knee. Make sure you don't put heat on your knee. Because the heat, sometimes it feels comfortable, but it will exacerbate the inflammation. It will exacerbate the swelling. So only put ice on your knee post-surgery. All right? And then do not forget, this is very important, consistency is key. You have to do your exercises, or you have to do these things that we mentioned on a consistent basis. You have to do it day in, day out, and you have to do it consistently. Why? Is because if not, then you will lose the compounding effect of the therapy, of the treatment. Compounding effect means one session builds on the other. So if your range is getting better as you do the stretch and you stop, it will stiffen up again and you will regress. And then you do it. So it's going to be, if you're not consistent, you're taking one step forward, one step back, and you're not going to get better consistently. You're just going to be wasting your time and you're going to be wasting your money. So let's make sure you avoid doing that. All right? So those are the few things that I want you to avoid and that I want you to do. I want to make sure you make note of that and start avoiding them or start doing them.